So welcome everybody. Good morning. This is the last week of lectures, so we made it. Good job, everybody. This whole week is all about workplace and health and occupational health. And so I'll start off this week's lectures today by sort of doing a bit of an intro to workplace and health issues. And tomorrow we're very lucky to have a guest lecture come in for the first half or so of the lecture. So she'll tell us a little bit about her kind of work, what her research is all about. She's a professor at U of T, someone who I looked up to a lot. She was an old colleague of mine from a research center that we used to both work at. And so I'm very excited for that. And then tomorrow, of course, we'll end with some course wrap up and just talk a little bit more about the exam since it is the last official class. So I think most of you are in now. And I do, of course, want to bring up that it's time for the course evaluation. So as a very new teacher myself, I'm sure I would definitely appreciate if you guys took the time to provide any sort of evaluations of this course, what you liked, how it went. Certainly, if you think that I should teach it again in the future, then do kind of leave some feedback and let them know what you thought about it. It does help to make sure that we take your feedback into consideration as we go forward in any future coursework. So do try to fill out those course evaluations. Now I want to start off today's lecture with just a quick little quiz. So how many hours do you guys think the average Canadian spends at work? Does anyone want to take a guess which one of these numbers is correct? So Sunima says B, 74,000. Some of you are saying C, 94,000. Any other responses? Seeing lots of C's. Yeah, so that is the correct answer. Now, that might seem like a bit of an abstract number, 94,000, but if you translate that into maybe something that makes a little more sense, we do spend about a third of our time overall in a workplace. So not at all an insignificant period of time. And hopefully, as we go through today's lecture, as well as tomorrow's lecture, we'll see why it is just so important to kind of consider the workplace as a determinant of health, how different occupational settings might influence different occupational injuries or diseases. So we'll spend a lot of time talking about that. Now, just as a kind of reminder of why we're talking about this stuff, remember we talked about this socio-ecological model, and we've spent a lot of time over the course of this semester talking about different determinants of health, different factors that influence health. So where we are in this kind of model right now is we're talking about these sort of workplace factors. Now, depending on how you think about the workplace, it might be considered something like a lifestyle factor, something that someone can change, they can switch occupations. But of course, we also know that in many cases, someone's job is not necessarily something they chose. Sometimes it's out of necessity because people need to work and they need to make money. And so it does kind of vary how you want to think about the workplace or occupations as a health determinant, whether that's sort of something that you would classify as these more socioeconomic factors or something that you would classify as more of like a lifestyle factor. But in any case, it is an important determinant of health. So what does the workplace actually include? Well, it does include, the physical kind of environmental conditions and how that might impact your physical health. So for example, if your job is located outdoors or indoors, how that might shape your health in different ways. There's also job stability. So whether or not you're employed consistently, for example, and how that might impact somebody's mental health. There's also inconsistent shift scheduling. And this is particularly important to consider with any sort of occupations that do rely on a lot of shift work. So we're talking about things like manufacturing, but also the healthcare setting largely relies on shift work, and just how difficult that is for many workers to kind of manage and balance things like a family life or time to themselves, personal time, time spent with friends or on hobbies and things like that, and the impacts on health that that can have. And of course, there is job dissatisfaction and how that ties into people's sense of well-being, how that ties into their self-esteem, and what kind of impacts that could also have on people's health and well-being. So the workplace is this kind of multifaceted factor. And over the course of the semester, we've kind of talked about a lot of topics that indirectly had something to do with the workplace. Things like the built environment, for example, could also be talked about in the context of the workplace. Socioeconomic factors that we've talked about can also be understood from a sort of lens if you look at it from the perspective of the workplace. So a lot of these factors do kind of tie into this concept of work and health, and occupational disease or injury. Now, I do want to highlight, because I thought this was an interesting kind of study. So just to illustrate why we're talking about some of these issues, something like job instability maybe doesn't seem like it's that big of a health issue. So what if people maybe don't have a consistent schedule for work? But when you think about it from the context of people who maybe rely on others for care, or for, a dependent, for example, like a child, this schedule instability has absolute sort of impacts on people's moods, people's relationships, how they interact with one another. So just to sort of illustrate this, if you take a look at how a parent's schedule actually impacts their child behaviors, there's evidence to suggest that the more you sort of have scheduling instability, the more that can influence a child's moods and how they might interact with others around them. So their sort of interpersonal skills. So it does tend to exacerbate some of these behavioral issues in children, and for a number of reasons, of course, but it could also be something like the stress that a parent might be dealing with from inconsistent work, or sort of inconsistent scheduling, as well as just not having that time to spend with their child, and how that might impact the child's sort of health and well-being. Now, what is it that actually makes workplaces risky to health? Well, a key kind of concept from this is that a risk happens when someone is exposed to a hazard at the workplace. So you need to have this hazard in a workplace, and you need to be exposed to it. And that's what happens when you have a health risk. So that health risk is really just the chance, or that kind of probability, that a worker or a group of workers are going to be harmed in some way. So they're going to have some sort of health outcome from that if they are exposed to a hazard in the workplace. Now, to illustrate this, there are many different types of hazards that do exist in different workplaces. And so I've put up this sort of image, and let's see if we can guess what these different hazards are. So if we're talking about something like a chemical hazard, do you guys see what would constitute a chemical hazard in the image? What might be a chemical hazard? So Zoe says the poison in the left corner. Yeah, so the cleaning products, is Sunima. What about a physical hazard? The knife, the puddle on the floor. Yep, deep fryer. So lifting the box up will actually be another type of hazard that we'll get to momentarily. But yeah, the physical hazards are sort of ones that usually tend to be associated with something like a slip or a fall, things like that. What about a biological hazard? Do you guys see any evidence of that? So biological hazard would have to do with the spread of kind of biological agents, maybe like bacteria, germs, any sort of infectious disease. So Esme says preparing food without gloves. Yeah. Savannah, is there blood on the knife? It does kind of look like that. There's a little bit of red kind of on the knife here. Uncleanliness in the workspace. Yeah, so if anywhere that there's a potential for this kind of biological agent to maybe spread, that would be considered a biological hazard. So you guys mentioned those. What about psychosocial hazards? So Sunil says grumpy customers. Yeah, he does look pretty grumpy here. Are there any other potential examples? Psychosocial. Rude coworkers could be one. Absolutely. Yeah, so any sort of negative kind of social interactions that might cause stress, for example, mean managers. Yeah, exactly. Not getting enough sleep. Yeah, that's a good one. Ergonomic hazards. What do you guys think? What could be an ergonomic hazard? Standing all day, lifting the box. Yeah, exactly. Any others? Constant bending down and reaching up. Yeah, exactly. So ergonomic hazards tend to be anything associated with kind of repetitive movements, things that might strain something like your muscles or joints. So even just if this particular worker was only responsible for this one kind of repetitive task, maybe she would see something like carpal tunnel develop in her hands. So there's many of these different types of ergonomic kind of hazards that might end up causing some musculoskeletal kind of impacts on the body, things like that. Yeah, so this was a very simple example, but hopefully it does illustrate the fact that any one single given workplace can have a multitude of different hazards. And you might not always be thinking about them all at the same time in the context of one space, but in many circumstances, they do all exist. And so these are all things that you need to control. You need to somehow manage these hazards in order to make sure that workers' health isn't impacted. Now, these might seem more like workplace kind of injuries or accidents that could be happening. But of course, we know that there are other types of workplace health outcomes, notably things like diseases. So we'll also talk a little bit about that. But to start us off, what is actually the cause of these different workplace injuries? So here in Canada anyway, most of the injuries do tend to be from what we call bodily reactions or exertion. So a lot of those kind of ergonomic hazards that would be associated with these types of overexertion of the body. So that's what is the primary sort of responsible hazard for injuries in any case. But also we saw a significant number of workplace claims related to contacts with objects and equipment. So this would be something more of like a physical hazard, people tripping over things like that, which might cause injury. And of course, falls are another big one. We also saw some psychosocial related kind of hazards that would result in things like assaults, violent attacks, harassment, things like that. And of course, exposure to harmful substances in the workplace is another pretty big one that is a little bit more relevant to workplace diseases instead of workplace injuries. So these workplace fatalities, these ones are a little bit different because if you take a look at these workplace injuries, you might notice that they tend to be associated with more of these sort of acute hazards, right? They tend to be more short-term. The health impact or the health outcome, whatever injury it might be, tends to happen shortly after the exposure to whatever hazard that you're talking about, whether it's a physical hazard or a psychosocial hazard, for example. But when we're talking about workplace fatalities, a lot of them do actually come from diseases that take a much longer time period. So that latency is longer between the exposure period and the health outcome that develops afterwards. And so a lot of these have to do with something like cancer. So you see that here with the neoplasms. And these are a little bit tricky to diagnose because, of course, we know that it takes many, many years for something like cancer to develop in the body. Sometimes it might happen many, many decades after a worker is exposed to some sort of chemical agent in the workplace. And so this does get a little bit difficult to diagnose. Of course, there are some other types of injuries that are associated with fatalities, and we should not minimize those by any means. Workplace tragedies do happen all the time, particularly in settings like construction. We know that actually a few years ago on Christmas Eve here in Ontario, we had a really tragic workplace fatality that happened along this God, what do they call them? The swing stages that was being used on one of the apartment buildings here in Toronto to make some repairs. And so this was sort of one big example that happened. That was a really sort of tragic example of why workplace fatalities are a really, really important thing to consider. Now, how do we actually identify, how do we track these different occupational injuries? Well, you might actually find that that's a little bit tricky to do. So it does depend on the province that you live in. Depending on the province, they have different sort of systems in place that are used to track a lot of these types of injuries. So for example, it might be an employer or an employee that's supposed to report an accident or an incident. And again, depending on the province that you might live in, this also might change whether or not, if, for example, you need a doctor's visit because of an injury, then that might classify or constitute an incident that needs to be reported. Sometimes it might be just any sort of injury that results in a workplace absence. Sometimes it might be some injury that requires working less hours or that impacts the number of hours that you can work because of your injury. Or sometimes it might just be some sort of work that has been modified due to your injury. So that would classify an incident that would need to be reported. Now, these incidents usually get reported to a workplace kind of compensation or insurance board. So here in Ontario, we call that the WSIB, the Workplace Insurance Board. Now, again, this does vary depending on the province that you live in, depending on the context you live in, but these compensation or insurance boards are really important because they effectively serve as these sort of databases that researchers or others can access in order to learn about some of these types of injuries that take place. You know, how frequently does something like a fall take place over time? Are we doing a better job at controlling some of these types of hazards? So they're really important that we actually do track these. Now, what is the sort of issue with putting the onus on the employee to report an accident or an incident that might happen in the workplace? What might be an issue with that? If it's the employee that has to report it. So Nicole says they might not come forward. Yeah. Alyssa says exaggeration for more benefits. Yeah, that could be an issue. Employees are worried about repercussions. Absolutely. Yeah, so to kind of answer your question there, Alyssa, we do have a system in place that actually, how to put this, kind of analyzes the report that goes there. So it's not that everybody who files a claim gets compensation. Usually it's based on some sort of evidence review. Let's say, for example, that it was a chemical hazard that we were talking about. So scientists who kind of work for this insurance board, the WSIB in Ontario's case, would have some sort of file on review that would say, okay, you know, these different health studies have said that, yes, there is probably a link from exposure to this chemical to this health outcome. So therefore, because of the evidence, we will accept this worker's claim and give them compensation. But so usually there does have to be that sort of evidence in place. They definitely don't want to pay everybody for any claim that comes in. So they do kind of have to narrow it down to, okay, what does the evidence suggest? Is there enough kind of supporting evidence around a particular hazard? But you're right, Grace and a couple of others that had mentioned any issues with potentially employees not wanting to come forward or they're being worried about repercussions. Absolutely. So if the onus is on the worker, right? If the employer finds out that their employee is maybe not happy, wants to see compensation, there could be some kind of animosity there because it's the employer that pays into the compensation board. And so they kind of get docked off these sort of points, if you want to think of it from this way, anytime that they do get a claim against them or something that happened in their workplace. So it's sort of in their best interest to not have workers claim any of these injuries. Now, ideally, it would be because the workplace is so perfect and that they don't have any of these sort of issues come up because they're doing such a good job of keeping workers safe. But of course, in the real world, sometimes it does happen or it does get sort of revealed that a lot of workplaces tend to try to suppress any sort of reporting that might go on. And so these workplace compensation or insurance boards do know that a lot of this happens. And so we know that the true number of injuries or fatalities that happen related to work exposures or workplace hazards is actually much, much bigger. This system really only does capture the ones that do get reported, that do the workers that claim some kind of injury or fatality that happened. Now, how do we actually identify occupational diseases? So diseases, again, are a little bit trickier because identifying whether someone's disease is due to some exposure, we can't rely on some injury that happened maybe yesterday or a couple of days ago or a few weeks ago. A disease tends to happen many, many years later. So usually you would have to start by identifying what was it that they were exposed to. So what kind of hazard was in that person's occupation? And this might be related to someone's job history. So let's say 20 years later, someone develops cancer, someone might have to interview them and ask, okay, well, where did you work 20 years ago? What were you exposed to there? Something like that. Then, of course, you would have to estimate how long they worked there. So how long they were actually exposed to the hazard, how frequently, was this a part-time job versus a full-time job, for example. And based on that, scientists actually are able to calculate the probability of certain diseases related to certain exposures in the workplace. So this particular figure is an interesting one. It is related to COVID. And so it's the risk of infectious diseases by exposure by different job types. So the exposure to diseases just sort of signifies the number of infectious diseases that someone tends to be exposed to in this particular occupation. And this axis here is a physical proximity to others. So whether that's proximity to clients or proximity to other colleagues that you encounter in a particular occupation. So what do we see? Well, we do see some interesting kind of occupations pop up as being particularly at risk of infectious disease exposure. So personal care aides, of course, we know those to be people like PSWs here in Ontario, we call them personal support workers. And those are some of those kind of nursing aides that would come and do maybe some in-home care or maybe assist some nurses in places like long-term care homes. But some others that kind of pop up that might be interesting to today's sort of context around what types of workplaces should be closed during COVID, what kind of restrictions we should have in place. So some examples here are things like retail workers, cashiers that might work in a retail setting, waiters or fast food workers, even hairdressers. So these are occupations that evidence would suggest would have the potential for exposure. So, whether or not that exposure is actually taking place in real time is a little bit more difficult to assess because, of course, that does it does depend on whether or not someone is using something like personal protective equipment safely, how many clients that they are actually booking into their system, for example. But there is a reason why some of these occupations have been targeted over the course of the last year in terms of any sort of restrictions on what kind of use or what kind of openings that they might have. What we do know, of course, is that a lot of these sort of occupations up here do tend to be the healthcare workers. So whether that's someone like a doctor in a hospital, but also someone like a dentist who does have to interact with patients who are not wearing a mask because, of course, they have to do dental work on them. So there are certain occupations that just by the nature of the types of tasks that you would do on the job are going to be much, much more riskier in terms of the risk of potential infectious disease exposure. Are there any questions about this slide? Do let me know if there was anything unclear about that. So Zoe mentions, I think they're thinking of reframing the vaccine rollout based on more occupational health risks. Yeah, there's been a huge, huge call for that. And I do hope that Victoria might actually mention some of that in tomorrow's lecture. Simnima says, I work as a cashier and even during lockdown, I check out over 100 customers in just a 4-hour shift. Yeah, so it's unfortunate that a lot of these types of jobs are associated with significant kind of person-to-person contact. As much as you might try to put limits or restrictions in place, at the end of the day, it is still a risk that comes down to the worker. So hopefully we'll see some more policies kind of targeted towards some of these very specific occupations and really try to help out certain workers in many of these kind of higher risk settings. Now, what are the actual rates of injury and disease or fatality in Ontario? Why do we, care so much about this stuff? Well, just to kind of put things into context, so these are the rates in the blue here for disease fatality, and the ones below are the injuries. So you could say that the frequency of the diseases leading to death are more common. They are more likely to happen compared to something like an injury. But what does this mean? Well, just to put it into context, I put some other kind of mortality rates that we might be familiar with. So the mortality rate in Ontario for asthma, for example, is 0.7 per 100,000. So that would put it below the frequency of the injuries. Something like diabetes is kind of roughly on par with occupational diseases, maybe a little bit higher. Something like COVID was responsible for about 51 over 100,000 deaths. And then something like cancer is something closer to 178, 180 per 100,000 in Ontario. So what this goes to hopefully suggest is that the burden of these kind of occupational diseases and injuries is definitely not insignificant. It does result in, a pretty big number of people being impacted on any given year. And what's sort of most important to highlight is that a lot of these occupational diseases and injuries are preventable, right? We have the tools in place to know what people are exposed to in a given workplace setting for the most part. Unless an employer is kind of withholding that information from a worker, most people know what kind of substances they're working with. They know what kind of hazards that they might encounter in a particular job. But what's the preventable part is that it really depends on whether the employer is putting those controls in, putting those, let's say, either engineering or personal protective equipment, for example, those types of controls to really minimize the risk to those workers. So a lot of these diseases, a lot of these injuries are preventable if the employer and the employee had just sort of taken those other steps to really ensure that that hazard did not pose a risk to the particular worker. Now, we spent a lot of time talking about the setting here in Ontario and Canada kind of broadly, but why should we care about workers' health and safety in other nations? Because I am going to kind of switch the focus of the rest of today's lecture to more of an international focus. Well, look no further than this topic of globalization and low wage labor. So we know that, for example, large multinational corporations do have a lot of power and wealth in certain low-income nations that they might operate in. So this does kind of pose this kind of power imbalance. In fact, there's this idea that there's this non-democratic sort of private government that sets in the form of this multinational company, because nobody votes for these companies to come into the country per se, but they do set up shop. They bring economic wealth to some places, maybe to some specific people who are in charge of the particular factory, let's say. And so this can be great because it can bring jobs, it can bring some money to a local population in a lower income nation. But of course, there are some cons as well associated with this. So what do you guys think? Can you think of any kind of negative impacts of what many of these multinational companies might have in a lower income nation? System News says we have an easy life because workers in other countries are suffering from MS. Yeah, Cassandra says unsafe workplaces. Yeah. Lamisa says they're not getting paid enough. Workers are overworked. Yeah. Do you guys think that the workers really have a say in their job, in their risks on the job? How much agency do you guys think they have over the decisions that they might make over where to work and how much to work, for example? Elisa says, no, probably very little agency, taking work that's available and consistent. Sanima says they've had very bad working conditions. I watched a documentary where garment workers in Cambodia working for George were being hit for falling asleep at work. Esme says very little agency. Most people are almost forced into these jobs. Yeah, so it is important to consider that a lot of this kind of power dynamic between these large multinational companies who set up in these countries and the workers that work there, many of them don't necessarily have the option of saying no. They are kind of forced in a way to take these jobs because, of course, they are jobs. It's better than no job. So they don't necessarily have that kind of input and can say, whether they accept a certain exposure, for example, at a workplace. It's not necessarily something that they can do. Simnima says, I don't think people are forced to work at these factories, but they work because they need income. Yeah, exactly. And so we'll get into some of these examples. Someone mentioned the garment workers. So we will talk about that in the context of another country. But in general, these companies at the end of the day are responsible for their shareholders, right? They are large corporations. And so they're not necessarily taking input from a lot of these workers. They're really, at the end of the day, only going to care about the profits that come in and whether or not they have a business operation that is profitable to them. So let's talk about that. Multinational companies might make their own rules in a lot of these circumstances, especially related to any sort of environmental or occupational regulations. And they do this either directly or indirectly. So directly, they can influence these rules by literally having politicians who are in charge of the laws in a particular country. They might put some politicians on the company's payroll in order to influence policies or regulations that are more favorable to a company like that. And so, unfortunately, this does happen in a lot of countries where corrupt politicians are kind of actively involved with a lot of these multinational companies in order to reap profits and benefits for themselves or kind of tangentially through their country. Indirectly as well, by just being so powerful and so influential in a low-income country, you could say that a lot of these local governments are actually scared of driving away the business of some of these multinationals. So they really give sort of free rein for whatever the company wants to do in a particular country because they would rather that company be there than pick up and leave and go to another country. So what's one way that we could actually make an impact on this? How could we change some of these regulations? Well, it depends on who's in charge of the enforcement and the safety related to these types of regulations, right? So in most cases, it's a labor inspector who is hired by some sort of government Ministry of Labor. Sometimes they have different names in different countries. Here in Ontario, in any case, it's the Ministry of Labor. And so these inspectors are usually the ones who are responsible for taking any sort of policies that have been set by the minister or whoever the government official is and actually implementing it. So they'll go around inspecting different workplaces and they might charge for any sort of infractions that they see in a particular workplace. Now, why could this be problematic? What makes enforcement either effective or ineffective if we're doing something like that using an inspector, for example? Do you guys think that would be an effective way to do it? Cassandra says they can be bribed. Absolutely. Are there any other potential problems? So Esme says fining large multinational corporations probably isn't effective because they can afford to just pay off the fine and ignore the problem. Yeah. Sarah says if you only need to follow the rules for a short amount of time while the inspector is there. Yeah, that's another thing. Sunima says corruption is high in these countries. Plus, they probably won't care about the workers. The inspectors won't care about the workers. Yeah, so it's definitely not a foolproof method, right? And again, it does sort of depend on the region or the country and just how effective their governing system is at the end of the day. The inspectors are only as good as the laws that have been put in place. And those laws obviously do depend on the government that's in power. And so if a government really doesn't have it as a priority of theirs to emphasize something like workplace health and safety, then they're probably not going to have very stringent laws or regulations that would actually protect those workers. So just to kind of talk about these different levels of inspection and enforcement that go on, two regions in the world that do have particularly low numbers of inspectors who are even out there kind of inspecting these workplaces are in Central and South Asia, as well as Sub-Saharan Africa. These also tend to be two regions that are pretty prominent in terms of things like low-wage manufacturing and some of these factories that many of us rely on to produce a lot of cheap products that we own. And so the average number of inspections are also similarly quite low because there are so few inspectors that actually go about and try to enforce any sort of labor laws. So unfortunately, this is a pretty ineffective method of making sure that workers are kept safe because there are so many limitations in terms of what an inspector is actually able to do and inspect and regulate. Now, what are some kind of recent examples of this? Well, the globalization of manufacturing in low-wage countries, as we know, has kept our prices pretty low for many, many different products. But it has also enabled the dangerous and cheap working conditions in many places around the world, particularly what we saw during the sort of ramp up of production of PPE, personal protective equipment during COVID. There have been some pretty scathing reports and kind of exposés that have been done by various news agencies. So I did find one that was really interesting from CBC's Marketplace. It's kind of a program that looks into a lot of consumer issues. And so what they found in a few different plants, factories that were in Malaysia were some pretty awful working conditions in order to produce some of the personal protective equipment that was being used even here in Canada. We're talking about factories that had no ventilation, definitely no sense of spacing or physical distancing for different workers. As you can see, they're pretty crowded, but also working, very, very long shifts. Naturally, this did lead to some COVID outbreaks that actually, ironically, happened in these PPE producing factories. And not only that, but of course, the workers do tend to be exposed to a lot of those types of psychosocial hazards that we were talking about. So whether that's something like physical or emotional abuse from other workers or managers, this absolutely does happen. In fact, many of the workers come from different lower income nations around Malaysia. And because they've paid many times really large fees for recruiting firms to actually be able to come and bring them into these factories, many of them are in debt in order to just pay off the sort of loan that they put out to be able to get the job in the first place. And so this has been called by some reporters as this example of kind of modern day slavery, because the workers need to keep working. They can't just quit because they have these really large loans that they have to pay off in order to just keep working. So it's a very kind of unfortunate situation that's unfolded there. Now, it is worth noting that Canada does still import a lot of PPE, things like gloves and masks, from a lot of manufacturers that have been tied to some pretty shady business. So unfortunately, we haven't quite closed this chapter yet. Now, what factors might make workplaces in low-income countries less safe than those in countries like Canada? Well, let's take a look at some of these. So we talked about the lack of regulations for workplace safety, for example. The right to protection is a sort of universal right, a universal human right that is supposed to be practiced. But in reality, the regulatory systems around occupational health are very, very complex. They are vastly different from one country to the next. And so this does make enforcement and even comparing regulations in different countries pretty difficult. It does require a lot of work between different stakeholders, whether that's something like a government and the employers, or also including some employee feedback and input into making sure these systems are effective. There's also a lack of worker rights. And so low-skilled workers are often treated as replaceable because, the company just sort of sees them as a number that they can sort of re-employ from another source. A lot of the times these workers have a fear of reprisals, of losing their job, because if the company is bankrupt, of course, then they can't work for them anymore. So it's really not in their best interest in many times to cause a fuss. A pretty prominent example of this happened back in 2012. And so there was a big protest that was going on in South Africa at a platinum mine. What ended up happening there is that the workers were on strike because they, wanted better working conditions. They were striking for higher wages. And this did not impress the particular mining company. So the mining company actually called the police to come and enforce and kind of shut down the strike that was happening. Well, for whatever reason, there was an escalation between the strikers and the police, and it resulted in the death of 34 workers who, were not there to cause any sort of violent uprising by any means. None of them had weapons or anything like that. But just due to this sort of escalation, the police ended up causing this, what is known as the Marikana massacre in South Africa. So this does have real life consequences and impacts, particularly in some of these low-income nations where really these workers are treated as kind of disposable and have very few rights. Now, there's also this lack of workplace insurance and compensation. So remember that we talked about that being particularly important in countries in order to be able to pay out any time that a worker does have a legitimate claim to make. Of course, they should be able to receive compensation if they can no longer work, right? But worldwide, only about a third of the labor force is actually covered by laws that would be related to something like that mandatory social insurance or workplace kind of compensation insurance. And there are differences according to gender, because of course we know women in some regions of the world, in some countries, don't necessarily have the same access to jobs. They might not be really encouraged to enter the same kind of workforce that men might be entering. And so there are differences in even the types of insurance that they're able to acquire through that. So notably, for example, in the Middle East, the coverage of the mandatory social insurance is significantly lower among women because many of them are just not in the workforce. But interestingly as well, in Latin America, we do see some differences in terms of the voluntary social insurance, which is things like retirement plans or life insurance policies that are linked through workplace policies. And so those tend to also be lower among women, specifically because women in a lot of these Latin American countries do tend to still have employment that's more self-employed. A lot of them are working as things like domestic workers. And so there's this whole sort of informal economy that's not necessarily part of the formalized economy where companies are offering these types of packages or these types of insurance programs. Now let's talk about these informal sectors. So what are we talking about when we're talking about informal work? Well, in other words, it could be something like a gig economy, any sort of things like location-based service delivery, things like that, freelancing. You could also think about that as the gig economy. Now, the problem with these is that it is pretty difficult to monitor things like exposures because, of course, these types of jobs are always changing. They depend on different locations. They're not necessarily in one particular place. Samima says, we also lack resources in general. We have to remember that these are developing countries versus Canada, which is a rich nation. Yeah, absolutely. So a lot of these countries do have just different systems in place because, well, the government has certain limits in many low-income nations in terms of what they can accomplish with such a lower tax base, for example. They can't necessarily fund things like programs or work and safety initiatives, things like that. But it is also difficult to manage a lot of these types of workers who do work in these informal settings. So particularly among women, there is a large portion of them who work in many of these low-income nations that are not necessarily going to be the types of workers that have access to a lot of these types of insurance plans. So we mentioned something like domestic workers, but also a lot of sort of lower skilled subsistence farmers, people like street vendors. These are occupations that are not necessarily going to be captured by these types of standards or these employer benefits. So unfortunately, they are largely excluded. Now, I do want to use, just with the last sort of 5 minutes of class, an opportunity to talk about a case study that happened called the Rana Plaza collapse. Now, this is a particularly important case study because it is, of course, the deadliest workplace incident that happened in the textile industry. So someone mentioned the garment factories as being a really important kind of exhibit for workplace health and safety. And so we will talk about that a little bit. So what was happening? Why are we talking about this particular case study? Well, Bangladesh is one of the top clothing producers and exporters in the world, second only to China, I believe. And the Rana Plaza building was this building here in the image, and it employed about 5,000 people. For any context of where it was located, it was northwest of Dhaka, the capital of Bangladesh. Now, the building owner had ties to a major political party. And so he actually kind of swindled his way into getting some permits for this building that were outside of the scope of what it was originally supposed to be built for. Originally, it was supposed to be intended for offices. Originally, it was only supposed to be, I think, 3 floors high. And so he kind of managed to go through all these loopholes in order to expand the size of the building and also kind of change what the intended purpose of it was going to be for. So what ended up happening? Well, after a few years, they started to notice that a large set of cracks were happening in the building support columns and as well in the sort of bottom of the building in the frame, in the concrete frame. By April 24th, there was a power outage that led to a number of diesel generators that were being switched on in the morning in order to still power a lot of these garment factory workers' equipment that were being used in that building. Within a few minutes of these diesel generators being turned on, the Rana Plaza building collapsed and it killed more than 1,100 people inside and injured another 2,500. Most of these fatalities and injuries were women because it is predominantly a kind of occupation that was emphasized for women. So many of them were working in these garment factories on things like sewing machines and equipment like that in order to build or produce a lot of these different textiles. So why did it actually collapse? Well, as we mentioned, the building was never meant for this type of industrial use. Originally, it was supposed to be used for offices. And so they think that due to the instability of a lot of these types of machinery that were placed in the building, it created a lot of vibrations in the building that were just too much for the materials to handle, given that it was never supposed to be used for that purpose. And so the building site was just not at all structurally sound. It was not made in a way that would support that kind of industrial activity. Remember that the upper levels were also built without those permits. And so they think that the weight of the generators that were being used, particularly on the upper floors, is what really caused this collapse to take place. Now, this was a tragic incident, and luckily the building owner did spend a little bit of time in jail, so there was some sort of sense of justice in some way for his role in this collapse. But overall, very few changes were made to the garment industry and the factory kind of working conditions. In fact, there's no evidence to suggest that customers even boycotted any of the garments that were made in this particular factory or others in Bangladesh. Some of those include notable names like Gucci, Prada, and many of these companies did not suffer any sort of financial impacts for their kind of role in allowing their own garments to be produced in such a manner in these unsafe working conditions. Now, unfortunately, fortunately for Bangladesh, this hasn't impacted their total exports. It hasn't really impacted their business, but it unfortunately hasn't impacted the conditions for the workers who are still working in these places. So more than 35 other textile factory incidents have since happened. So this has not at all been something that has stopped from taking place. Sunima says, I don't think that is justice, 6 months in jail for killing 1,000 people. Yeah, you could argue that, this guy should have been locked up for years and years. He should have never been allowed out. But remember that he did also have some pretty powerful political ties, the whole reason that he was allowed to sort of build this building in the first place. And so it was seen in some circles as at least a partial justice to at least have had him even be accused and, face some sort of repercussions for this crime. But yeah, it's a big question mark whether or not justice was really served in this particular case. Notably, there was no compensation given to the survivors from the employers because in Bangladesh, there's actually a different kind of insurance system in place. It's not a workplace safety insurance board that an employee would file a claim to. It's really up to the worker to kind of file a lawsuit against a particular company or an employer. And so this is likely not going to result in any sort of big compensation or lump sum for these workers anytime soon. So what did we learn since then? Well, we learned that governments could do a lot more to balance something like industry profits with worker health and safety. Of course, they could implement stronger regulations, they could implement more enforcement, they could also implement something like that workplace insurance injury compensation system, something like that in Canada. Had it occurred, those workers would have received some sort of compensation for their injury or for the fatality among the family members. But unfortunately, this is not really the circumstance there. Simnima says, I think we as consumers of these products and companies were also in some way responsible for these deaths. It's a bitter truth. Absolutely. So yeah, a lot of kind of pushback after this was that consumers could add a lot more pressure to employers to ensure better working conditions. In this particular example, there was no real sense of boycotts against many of these companies that were responsible in many ways for this tragic incident. None of these companies were really held to account. And this is unfortunately a pretty common circumstance or outcome among these multinational companies who usually escape any sort of responsibility or accountability. So we could probably do a lot more to hold these companies to account for any sort of occupational or environmental disasters. Now, that's all that I have today. So I think we'll end it there. But if anybody has any questions, let me know. And as I said, tomorrow we do have the guest lecture coming in.